Our lecture today is about tuberculosis. TB can be defined as communicable chronic granulomatous disease caused by acid-fast bacilli called Mycobacterium tuberculosis. Regarding sites of involvement, tuberculosis infection usually occur in the lung and called pulmonary Tb. It can be occur in other organ and tissue in the body such as meninges, kidney or spine, and this type is called extrapulmonary Tb. Regarding the factors that increase the risk of tuberculosis infection, these include poverty, crowding such as prisons or institutions, chronic debilitating illnesses such as diabetes, Hodgkin lymphoma, malnutrition, alcohol or HIV. And last, it can occur in elderly person because they usually have immunocompromised states. Regarding the route of transmission, the organism or TB bacilli are transmitted from an active case to a susceptible individual through airborne droplets. Regarding pathogenesis of TB, tuberculosis infection in a previously unexposed individual, يعني person who infected for the first time and has good immunity, will result in the development of cell-mediated immunity. انتوا تعرفون إنه الإميونيتي عندنا two types, cell-mediated which is mediated by cells such as lymphocytes, or humoral immunity which is mediated by antibody, complement, etc. ففي حالة الTB راح يصير عندنا cell-mediated immunity. بالبداية راح تدخل الأسيد فاست bacilli أو TB bacilli through airborne droplet into the lung. باللنج وين راح تدخل؟ راح تدخل inside the macrophage because they are intracellular organism. بالحالات الاعتيادية المايكروفيج عندها قابلية for destroying ال intracellular organism. فرضا هذا الفاجوسوم of macrophage وهنا الأورجانيزم، فتقدر تسوي destruction of this organism by the fusion of lysosome which contain enzyme such as nitric oxide and reactive oxygen species. These enzymes are highly bactericidal، يعني عندها قابلية إنه تقتل البكتيريا، فراح يصير fusion of lysosome with phagosome و result in intracellular killing. بحالة الTB bacilli عندها قابلية إنه تمنع prevention of phagolysosome formation، وبالتالي تقدر تسوي لنا proliferation inside the macrophage. بهاي الحالة الماكروفيج راح تطلب مساعدة من التي سيل لأنه هي ما تقدر تقضي عليها، فراح تسوي presentation للانتيجين of bacilli عن طريق ال MHC class 2 molecule into the T lymphocyte. راح تسوي activation لل T lymphocyte and mainly T helper 1. So the T cell will be sensitized and activated. The T helper 1 will secrete cytokines such as interferon gamma to activate more macrophage. This activated macrophage will secrete elevated level of nitric oxide which has an antimicrobial effect. This activated macrophage will secrete more cytokines such as tumor necrosis factors to recruit more macrophage. These new monocytes will differentiate and activate it to form epithelioid histiocytes. This type of cell will mark the formation of a granuloma. So the end result of TB infection is granuloma formation, as illustrated in this picture. The granuloma will contain central necrosis. This necrosis results from tissue destruction because of cytokine production. And type of necrosis is called gaseous because it contains cheese-like material. This central necrosis will be surrounded by epithelioid histiocytes which are differentiated macrophage. It looks like epithelial cells, so it's called epithelioid. And surrounding the epithelioid histiocytes are sensitized T cells. Sometimes this granuloma contain large cell which contain multiple nuclei. This type of cell is called multinucleated giant cell. Cell contain different or many nuclei. This granuloma will prevent dissemination of TB bacilli. Tuberculosis can be divided into primary TB. Primary TB means that the person is infected for the first time with TB bacilli, or secondary TB means the person is infected for the second time. In primary tuberculosis, the bacilli enter the lung through airborne droplets and mostly implant in the lower part of upper lobe or in the upper part of lower lobe. This is the location of a primary tuberculosis. Regarding the morphology or gross features, tuberculosis infection results in the formation of parenchymal lesion. Parenchymal lesion يعني lesion inside the lung, and this lesion is called gone focus. The gone focus plus lymph node involvement is called gone complex. Gone complex. When this complex is calcified, it will be called Ranke complex. So regarding the morphology, we have parenchymal lesion called gone focus plus lymph node involvement is called gone complex. When gone complex is calcified, it will be called Ranke complex. This gross feature demonstrates gone complex, which consists of parenchymal lesion. This lesion located in the lower part of upper lobe and lymph node involvement. Regarding microscopical feature, this picture demonstrates granuloma, which consists of central gaseous necrosis surrounded by epithelioid cells, epithelioid histiocytes. And also there is a multinucleated giant cell, which consists of multiple nuclei. Regarding the consequences of a primary tuberculosis, يعني من يدخل ال TB bacilli for the first time شنو الفate or consequence? Either result in hypersensitivity and resistance, يعني result in granuloma formation and resistance. And TB bacilli inside the granuloma will be entirely killed or destroyed, يعني result in healed lesion and no viable organism، يعني ماكو organism تقدر تسوي reinfection، كلها killed. هذا الفيت الأول. الفيت الثاني called latent tuberculosis. شو قد يصير latent TB؟ راح يصير granuloma formation عادي، بس الجرانيولوما contain viable organism. viable means able to reinfect، عندها قدرة إنه تسوي infection مرة ثانية. بس شنو الجرانيولوما تحوطها وتسويها بشكل latent، يعني ماكو infection. الانفكشن شو كده يصير من البيشنت is immunocompromised، يعني الاميونتي مالته والديفنسز تضعف، مثل بحالة ياخذ drugs or diabetes or HIV. من يصير immunocompromised هاي الviable organism inside the granuloma راح يصير بيها dissemination وتسوي لنا reinfection. الفيت الثالث هو ال progressive primary TB. Progressive primary tuberculosis mostly occur in HIV patients who has CD4 lymphocyte less than 200 cell per microliter، يعني عندهم الليمفوسات قليلة. بحالة ال progressive primary TB no tissue hypersensitivity، يعني there is no granuloma formation، ما عندهم granuloma، وبالتالي ال organism are not contained، يعني يصير بيها dissemination to the body to other tissue in the body وتسوي infection. regarding the microscopical feature in progressive primary TB ما راح نلقي granuloma formation مثل النورمال، راح نلقي بس foamy cells or foamy histiocytes packed with bacilli، يعني بس نشوف macrophage وتحتوي على bacilli بداخلها، ما نشوف granuloma formation or gaseous necrosis. هذا النوع احنا نسميه non reactive TB، يعني TB ما يسوي granuloma formation، يصير بحالة ال HIV patients. Regarding secondary TB, it may result either from reactivation of latent infection or reinfection through airborne droplets containing TB bacilli. Regarding pulmonary involvement, secondary TB will result in formation of parenchymal lesion, usually located in the apex of the lung. هذا location مهم, which distinguishes secondary TB from primary TB. It may also result in formation of miliary pulmonary disease. شنو يعني miliary pulmonary disease؟ هنا عندنا two lungs. الملياري هي عبارة عن multiple small foci of consolidation usually bilateral، وتكون حجمها small mostly 2 ملم، وتشبه الميلت seeds يعني حبوب الدخن، لذلك يسموها ملياري. إذا صار small foci of consolidation in the lung نسميها miliary pulmonary disease، وإذا صار بالother organ in the body whether spleen kidney نسميها systemic miliary tuberculosis. The TB may also infect or extend to the pleura and result in pleural effusion and tuberculous empyema. Regarding extrapulmonary lesion, the bacilli will disseminated by hematogenous spread through arterial system to different organs in the body, mostly in the liver, bone marrow, spleen and kidney. This gross picture demonstrates miliary TB in the spleen. هاي تلاحظون هنا هاي small foci of consolidation. Regarding the diagnosis, how we can diagnose a patient present with active TB. First, history. TB mostly causes systemic manifestations such as malaise, anorexia, weight loss, low-grade fever, or symptoms result from local lesions such as cough, may cause hemoptysis, or a sign and symptom according to the organ involved. For example, if TB occurs in the spine, it will result in back pain. Physical examination include general examination and respiratory examination. Regarding the investigation, we can perform chest X-ray to recognize the primary lesion or secondary lesion, lymph node involvement, pleural involvement, miliary pulmonary tuberculosis, etc. Most common method for diagnosis of pulmonary TB is sputum staining by a special type of stain specialized for acid-fast bacilli called Zell-Nelson stain. The gold standard for diagnosis of pulmonary TB is culture, but this method takes a long time to obtain the results, about up to 10 weeks. This microscopic picture demonstrates staining of acid-fast bacilli. Regarding this case, we have a 22-year-old man with the acquired immunodeficiency syndrome complaining of persistent cough, night sweats, low-grade fever, and general malaise. A chest X-ray reveals an area of consolidation in the lower part of upper lobe and lymph node enlargement. Sputum culture show acid-fast bacilli. What is the most likely diagnosis? خلينا نفصل الكيس. عندنا من الهيستوري patient عنده cough, night sweats, low-grade fever and general malaise in addition to history of AIDS disease. بالانفستيجيشن عندنا chest x-ray وعندنا sputum culture. chest x-ray شافوا lesion or consolidation وين موجودة بالlower part of left upper lobe. والسبيوتم culture شافوا acid fast bacilli. These findings are consistent with tuberculosis. Which type of TB, primary or secondary؟ نعتمد على شنو؟ نعتمد على الليجن، اللوكيشن of lesion in chest x-ray. ما دام عندنا lower part of upper lobe معناته هذا primary، لأن مثل ما قلنا secondary يصير بالأبكس. إذن most likely diagnosis is primary tuberculosis. What are the microscopical findings in this patient? This patient has acquired immunodeficiency syndrome, which is caused by HIV virus, human immunodeficiency virus. In this type of patient, we don't have a granuloma formation. We have macrophage, foamy macrophage packed with acid-fast bacilli. يعني ما عندنا الجرانيولوماس اللي تصير بالnormal patients. Because this patient lack hypersensitivity. عدة T lymphocyte قليلة، ذاك ما يصير عنده normal immunity. Which stain can be better for acid-fast bacilli? Is Zell-Nelson stain. What is the primary lesion called؟ يعني primary lesion by X-ray شو نسميها gone complex. ليش؟ لأن عندنا gone focus اللي هي parenchymal lesion in addition to lymph node involvement. الفate of disease احنا هنا ايش راح يصير بالديزيز؟ راح يصير ببروغريسيف primary tuberculosis. والبروغريسيف primary tuberculosis ممكن يؤدينا إلى miliary TB, whether miliary pulmonary TB or systemic miliary tuberculosis. And thank you for your listening.